Hi, I'm Mary Wong, Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health Clinic, and author of the book Pathways to Pregnancy, and I'm your life and wellness and fertility coach. Welcome to my live post number 89, and I'm really thrilled to be here this evening because tonight is the first time, and it's my 89th time being here, that I'm actually going to read an excerpt from my book. So I'm really excited to do so with you because really, almost 2 years ago. So in 2016, my book came out and I've never done an excerpt reading. And the reason why I wrote this book was to make a difference for you because I can only reach so many people through my practice. And I would love to be able to make that difference for you out there that will never be able to come. And, and provide the resource that you need to give you true hope and possibility that you can overcome your challenges. And so tonight, I'm actually going to read about making the impossible possible. That's chapter 7. Now, I recommend from the beginning of my book to read continuously from chapter 1 on, but I just wanted to pick something from the middle of the book. And to tell you a little bit about it, it's a book of 15 stories, and they are hopeful because it spans a lot of different challenges that you'll see, and also the various pathways that women and couples go through in order to build their family. So it's quite extensive, but the most important piece is that, as the book actually says, it's stories that are hopeful, and it's practical advice that really no doctor will ever tell you. And unfortunately, the internet can only say so much without adding in other people's opinions, and it gets blurred from facts, and the other people's experiences are not your experiences. So we can't compare and contrast and try to do what others are doing. So when I tell stories about my patients and myself, by the way, so my story is in one of the chapters, it's not to say, hey, do exactly what I'm doing or do exactly what they're doing, but doing what's right for you, and they vary. And so it's literally using different types of techniques, which may include Chinese medicine as well as Western medicine. For others, it's only Chinese medicine or nothing. And for others, it could be full-on intervention, and that's that. So anyway, on with the show. And because I want to make it timely, where I've always promised my viewers to do like a 20-minute thing. So I'm going to read chapter 7, and basically either I finish it, or if I don't finish it at 20 minutes, then we'll just do a quick sign off. But I think you'll get the gist of it. So I really hope that you'll benefit from this. I know people who have read my book have all reached out and said, wow, I've read every book out there, and this is the only one that's made a difference and made it hopeful for me in my journey. So that's my hope. So here we go. Making the impossible possible. Natural forces within us are the true healers of disease. Hippocrates. Miriam. Autoimmune infertility. Miriam, a banker, met her husband at 19. They married at 32, and she got pregnant naturally, but accidentally, and then miscarried. They didn't investigate the cause of the miscarriage and continued using contraception until they decided to focus on building a family when Miriam was 34. Despite the miscarriage, she did not anticipate any problems and certainly did not expect a 7-year journey. When they did not get pregnant after 1 year, they went to a fertility clinic, and she was diagnosed with unexplained infertility. She underwent 4 IVF cycles prior to coming to my clinic on the recommendation of a friend. At this point, frustrated by a diagnosis that provided no explanations for her failed IVFs, and therefore without a treatment strategy, Miriam was experiencing anxiety and depression. She sought TCM treatments, traditional Chinese medicine treatments, to balance her body before undergoing any more procedures with the fertility clinic. After working together for 2 months, She was thrilled to conceive twins with her fifth IVF, but her joy quickly turned to devastation when an ultrasound revealed they'd stopped developing at 6 weeks. Miriam had a D&C, and the products of conception were analyzed, revealing an unexpected genetic issue called Robertsonian translocation, in which a piece of a chromosome breaks off and is moved to another chromosome, resulting in a structural chromosomal abnormalities. So now, in addition to feeling reproductively old, Miriam was dealing with a genetic issue. Fortunately, it could be addressed by doing IVF with pre-implantation genetic screening, aka PGS, a process of removing cells from a day 5 or 6 embryo, which has many cells. This embryo is then tested for genetic viability before being transferred to the uterus. Chromosomal translocation. This condition accounts for 2 to 4% of recurrent pregnancy loss. According to a study out of the Netherlands, couples in which one is a carrier are 20% more at risk of miscarriages over non-carrier couples experiencing recurring miscarriage. However, in both cases, they're equally likely to give birth to a healthy child. And I have more to say about that, but you don't need to get into it. Just know that the possibility is there. Normally, when women are tested only for chromosomal translocation issues after 2 or 3 miscarriages. Men have the same chromosomal abnormality causing miscarriage. In fact, I see more cases are due to the male side, by the way. Men can have the same chromosomal, I read that. About 1 person in 500 has a balanced translocation, which makes it uncommon, as documented in 1998. One study, though, showed that only 0.1% of 1,415 Japanese couples, meaning 2 women out of 1,415, experiencing multiple miscarriages, had translocation mutations. Chromosomal balanced translocations or rearrangements can happen naturally during sperm production, especially in older men, or when the sperm unites with egg at fertilization. They may develop spontaneously or be passed down in families from parents to child. This chromosomal rearrangement can occur irrelevant of men's lifestyle, environment, or work. Intensive intervention. Miriam's problems didn't end there. She also had uterine fibroids, which are non-cancerous tumors composed of dense fibrous tissue. Although they'd been present for as long as I'd been seeing her, upon examination after the D&C, I noticed they'd grown to the point that were visibly distending her abdomen. Chinese medicine and acupuncture can help dissipate or shrink fibroids up to about 3 centimeters. That's what I've witnessed. That's what many of my colleagues have witnessed. But if they're long-standing and dense, they're unlikely to be eliminated naturally. Miriam's fibroids were not seen as a factor in her fertility challenges. That is because many women who have fibroids do not experience impaired ability to get and stay pregnant. Having been exposed to multiple rounds of IVF and due to her twin pregnancy, Miriam had a surplus of hormones in her body, which had likely fueled the growth of her fibroids. When they became palpable by hand, I explained that they could be another factor interfering with embryo implantation and development, and Miriam requested that her fertility doctor perform a myomectomy, a surgical procedure to remove them before trying to do another round of IVF. During the procedure, the doctor removed 19 fibroids, ranging in size from marbles to tennis balls. What is autoimmune infertility? Miriam continued to relentlessly search for answers to her failed pregnancies, suspecting she had immune issues because her mother had Sjogren's disease, dry eyes and mouth as a result of immune cells interfering with salivary and tear gland secretions, and her sister had hypothyroidism. Miriam paid for extensive testing by the controversial Alan Beer Resource Center for Reproductive Immunology and Genetics, which offers treatments not approved by most fertility clinics, including Miriam's. She was diagnosed with autoimmune infertility, meaning her immune system was rejecting the embryo or preventing implantation. Controversial treatments. Typically, Western medical fertility specialists believe some women's immune system recognize and reject their partners or donor sperm or embryos as foreign invaders. The immune system protects the woman from this foreign invader by preventing fertilization, implantation, or development during pregnancy. This can lead to repeated failed IVF attempts or recurrent miscarriages. Dr. Alan Beer, author of Is Your Body Baby Friendly?, has developed some controversial treatments to treat fertility challenges related to an autoimmune response. Some women with complex fertility challenges have successfully used some of these treatments to carry a healthy baby to term. But the treatments are controversial because they use blood byproducts made from up to 50,000 healthy donors mixed together, which are then injected into the woman's arm as a therapy. Miriam opted for a treatment called lymphocyte immunization therapy, LYT, which involves injecting the male partner's washed and extracted white blood cells into the female's forearm. Theoretically, this allows the body's immune system to develop an antibody response to her partner's cells, so her immune system will recognize the embryos as self rather than an invader to be killed off. So as of 2016, this treatment is illegal in the US and only offered to some of the patients at Markham Fertility Center in Canada. And this is just outside of Toronto. Now we're in 2018, and I have not updated to see if there are other places now that are doing it in the US or Canada. However, at the time Miriam did LYT, it was not available in Canada, so she and her husband went to great lengths to have it performed in Mexico. First, they drove to a McDonald's on the American side of the US-Mexican border, where a van transported them to a lab on the Mexican side. It was a weird and sketchy experience, but the only side effect of the treatment was itching at the site of injection, thankfully. Like most patients, Miriam did multiple treatments in preparation for IVF. Once the patient becomes pregnant, she gets booster shots every 5 to 7 weeks to protect the baby. So I can only imagine how stressful and costly it must have been for them to travel to Mexico for this treatment every single time. So I never asked her how much she spent, but I can just, can you imagine? Anyway, in addition, Miriam had intravenous immunoglobulin G treatments, which is called IVIG. Theoretically, this IV drip cocktail of immune cells, antibodies, again, from the blood products of up to 50,000 donors, prevents damage to the embryo and uterine cells as a result of an abnormal immune response. Specifically, it aims to decrease excessively high levels of natural killer, or NK, cells from attacking the partner's sperm or the embryo. So, as a side note, off script, Miriam did have high NK cells in her bloodstream, so that's why she was doing this. Finally, Miriam took dexamethasone, a steroid, and Fragmin, a blood thinner, throughout her IVF treatments. The steroid was used to reduce inflammation and autoimmune response by reducing NK cell activity. Although this was not Miriam's issue, it can also decrease male hormones like testosterone, which can contribute to PCOS. The blood thinner was to prevent blood clot formation, which can cause miscarriage. These two drugs are standard treatments that her fertility clinic advised her to undertake for autoimmune issues. It's a very, very, very common protocol, actually. As for having LYT and IVIG treatments, Miriam opted not to tell her fertility clinic while undergoing IVF with them because she knew her doctor did not approve of them. This added to her stress at a time when stress was the last thing her body needed. My view on autoimmune infertility. Alan Beer, the inventor of the controversial procedures described above, among others, believed a woman's activated immune system could damage the placenta or embryo, reject implantation, or interfere with reproductive hormones and prevent pregnancy from occurring. Correcting this required immunosuppressive treatment so the woman's body would recognize that embryos were not foreign invaders. In describing this phenomena, he wrote, "Women become serial killers to their own babies." Like, seriously? I find this harsh, judgmental, and totally blaming. And it's like as if a woman with autoimmune reaction is at fault. Not. So I see autoimmune reaction as the body's way of expressing its state of being out of balance, but thinking it's doing the right thing and protecting itself from harm. While I've had patients like Miriam who've used beer strategies to become pregnant, and I'm not opposed to such treatment but from a TCM standpoint, it's a symptomatic treatment in that it does not address the underlying cause of the autoimmune reaction because it's suppressing it, right? It's not helping to reverse it. TCM asks why your body is seeing an embryo as a foreign invader in the first place. Perhaps it's another way your body says, no, not right now, to having a baby. With blood tests showing excessive antibodies, NK cells, and other autoimmune markers, this might be a sign that your body is reacting to prolonged internal and external environmental stressors. Perhaps supporting this theory, Miriam did not have to do any of the autoimmune protocols for her second pregnancy. Neither did Krista, my second autoimmune case study. I will tell her story later in this chapter. It's stressful to think your own immune system is like an army of soldiers killing off your embryos, and negative thinking can contribute to creating an unappealing environment for a baby to move into. When my patients have autoimmune challenges, I encourage them to think about what's happening in their lives that could give their body a reason to say no, not to having a baby right now. I urge them not to self-blame, but to reflect about what is not aligned within themselves at the present time or in the past, and to ask when they last experienced peace, happiness, love, and connectedness. This diagnosis is not a question of whether you deserve to get pregnant, and it's certainly not your fault. Please, it's really not your fault. It is simply a state of being at a moment in time. Under the right conditions, your immune function or response may be normalized. Everything but the kitchen sink. Miriam was resourceful in taking control of her fertility, health, and trying just about everything a woman can do to have a child in her womb. In addition to IVF treatments with genetic testing, paired with traveling to undergo immunosuppressive treatments, she kept working at a full-time job. She came to my clinic regularly for acupuncture. She did yoga and meditated, and she had mind abdominal massage, a special massage for increasing blood flow to the reproductive organs while trying to break up any scar tissue or inflammation. And she tried hypnosis, energy healing, and colonic irrigation. She took supplements including CoQ10 and PQQ to help with egg quality. See Chapter 4. Fish oil to decrease inflammation, milk thistle to support detoxification, and wheatgrass to clear out excess hormones from previous IVFs. She took Chinese herbs to move internal static blood and decrease inflammation, and as well as DHEA, an adrenal hormone that converts testosterone or estrogen, and is thought to enhance egg quality. Upon my suggestion, she switched to an organic, gluten and dairy-free diet. Finally, she went to a naturopathic doctor who tested her for food allergies and removed certain foods from her diet that, according to her blood tests, triggered an immune response. From a Western perspective, Miriam had a complex set of fertility challenges, from an unexplained to autoimmune infertility with genetic factors, fibroids, and advanced maternal age thrown in. When she conceived following IVF with PGS prior to frozen embryo transfer, FET that is, in which embryos harvested during a previous IVF cycle are frozen and then thawed before transfer to the uterus. Anyone might have said it was these interventions, as well as the immunosuppressive therapy, that enabled her to conceive and carry beautiful baby Audrey to term. However, from a TCM perspective, while these treatments addressed her symptoms, they also caused side effects that threw her body even more out of balance. Specifically, her fibroids grew to the point she needed to have them surgically removed, and the stress of the whole process may have increased her body's immune response. After the many years I've worked with women who defy the odds and become pregnant, I believe TCM, lifestyle, and dietary changes and positive thoughts are as important as technological interventions. And perhaps these things helped Miriam maintain as much balance as possible while pursuing extreme treatments and benefited her in ways science does not yet comprehend. One more time. Although Miriam was grateful for baby Audrey, she kept thinking that she had one chromosomally normal embryo sitting on ice. She and her husband wanted to try for a second child. She came back to me for some acupuncture treatments to help rebalance her body before she attempted another FET, which I like to describe as picking up the kids from the skating rink. Miriam was maintaining her healthy diet and resumed her preconception treatments, focusing her attention on creating a healthy environment, toxin-free and populated with positive thoughts, feelings, and expectations. As well, her recent autoimmune testing indicated that her body was no longer in an overactive immune state. It was no longer saying no, not now. I agreed with Miriam that it seemed like her body was receptive, and she went ahead with the transfer using her final frozen embryo. As I write, she had just given birth to her second child, Thomas, via C-section. Thankfully, all went smoothly, and they are just adjusting to demanding newborn schedules of eating and sleeping every 2 hours. Epigenetics. I'm reading quite a bit, so I think what I'll do is I'm going to finish this last bit. There's so much more juicy things. You have to read this. But I'll read this one on epigenetics. Epigenetics. This is where the science of epigenetics come in, where gene expression and appearance can be turned on or off, and even passed down to your children, depending on internal and external environments. That means your DNA does not have the final word in determining your genetics. Dr. Bruce Lipton, author of The Biology of Belief, states that a cell's life is controlled by the physical and energetic environment and not by its genes. That means what we think, believe, and perceive can impact our brain, in releasing a cascade of hormones that can ultimately affect our reproductive function, egg cell division, egg development, and uterine lining. That is, how we respond to our environment physically, mentally, emotionally, and spiritually affects our health, and in this case, our fertility. Dr. Lipton goes on to say that beliefs control biology. According to him, by being conscious and aware of our thoughts and perceptions of things, events, and stresses in our lives, and then altering our responses to them, we can impact our brain chemistry, which then impacts everything down to the way to our cells' growth, divide, and thrive. As he puts it, we are not stuck with our genes or our self-defeating behaviors. I love that. Western medicine, he says, fixes the body like a mechanic fixes a car in terms of its parts. But what about the driver? It's not the mechanic's job to fix both car and driver, but it is arguably the doctor's job to do so. So this is not, oh, thank you, Leslie. Pick up my book. You'll love it. Whether you have fertility challenges or not, whether you know other people or not, I totally recommend that you read this, because likely 1 in 6, meaning anyone you interact with, whether it's at school, whether it's at work, whether it is at Starbucks near you, if there are 20 people in the room, likely at least 3 people are having fertility challenges. So if you think that it's irrelevant for you, it is not, because you know someone, whether you know it or not, that have fertility issues. And if you already know me already, you get to read about me in one of the chapters. So that's a bonus. So that is the conclusion for this evening. So please do pick up my book. You'll love it. And you can get it through Amazon, or by the way, you can even request your library to carry it. So you can do that. And why do I say that, right? Like, I really should have you to buy the book, but here I am telling you to take it out of the library because I'm crazy. Now, one exciting news, I'm going to convert this book into what do you call it? An audiobook. So I'm really excited to do that, because as you and I both know, we're all really busy. I'm doing much more in the way of audiobook. When I'm commuting to work, I am listening to my books. So I want to do that for others. So you can be doing this anytime, anywhere. You don't have to have this book sitting on your lap and worrying about other people seeing the title, even though it doesn't have a picture of a baby or a pregnant woman, which I did that intentionally, by the way. So do that and get the book, but the audio version, I'm hoping I'll get it out in the next couple of months, okay? And please also join me for my live monthly fertility circle. That's coming up this coming July. I think that's the first Sunday in July. Excited about that, because unlike what I do here with just regular resources and advice, what I do there is quite different, because I'm more about transformative work, and it requires something out of you, and I'll be asking questions and digging deep and having you do some work and writing down notes. So I'll teach for an hour, and then there's options for a Q&A for all the participants, and it is a private group, not Facebook. It's a paid course, and I'll tell you something, it's a steal of a deal, because if you come to see me privately one-on-one, it'll cost you a lot more. And well, $300 currently, which will go up. But if you do this program, you're going to get it for $29.99. So you get to have me once a month. Like, awesome. And you get to reach out, and you get access to all the previous posts. So please join it. And you can find it through marywong.life. If you click that under coaching, then it'll hook you up into another page where you can just sign up. So I really can't wait to see you there, whether you are a person having issues, troubles conceiving, that is, not other issues. And for practitioners that want to be able to help transform the lives, because I know I'm really good at it, and this is what I do, and that's why I have it out for you, because it's like, again, gosh, I wish that I'd be able to serve and help others who are in need, that will never, ever be able to come to my office and never be able to perhaps even afford it. So this is a very affordable way of doing that. Okay, so thank you for being here. Love you guys. See you next Wednesday, 8:30 p.m. Eastern Standard Time. And we're going to be talking about detoxing, like post any kind of IVF, or if you just had a horrible, awful diet. And we'll look at the TCM perspective, Chinese medicine perspective. And I'm not doing it by myself. I'm going to be doing it with my awesome colleague, Tanya Smith. So join me next Wednesday, 8:30 p.m. Eastern Standard Time. In the meantime, like my page at Mary Wong RTCMP. Scroll down. You'll see lots of different awesome posts. And you can check out my website again, marywong.life, where you can click on order my book and sign on for my live monthly fertility circle. Okay, thanks. Take care. Have a great night. Mwah.